Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
I am pleased to welcome Dr. Dan Reidenberg to the show, a clinician with a lifelong commitment to the work of mental health and suicide prevention. Dr. Reidenberg is Managing Director at the National Council for Suicide Prevention, Executive Director for the Suicide Awareness Voices of Education, Chair of the American Psychotherapy Association Advisory Board, and Chair of the Certified Relationship Specialist Board. Welcome, Dr. Reidenberg. I'd love if you could take us back to your early years. When and how were you drawn to the study of medicine?
No, I've been interested in this really since I was a young boy. When I was 5 years old, I told my mom that I was really interested in learning more about the body, and in particular at that time, heart. As time changed and I grew, I developed really this interest in people and talking with people and learning about their emotions and why their behaviors were what they were. So for me, this has really been going on since I was a young child, being really interested in people and how we function and how we work, and that's just grown over time.
Awesome. You are well known for your dedication to suicide prevention and work in various leading roles within this space. Would you mind sharing how you came to focus on this particular topic?
I know it's really interesting how I got involved with suicide prevention, and I have kind of a mixed background in that. I lost 6 patients of mine to suicide, which is a devastating loss as a clinician and a provider. Anybody in healthcare, our lives are focused on healing and helping and being there. And when we lose a patient, doesn't matter how, but when we lose a patient to suicide, it really challenges us in our work and our lives. So I've lost patients to suicide. I've lost family members to suicide. I lost a good friend of mine to suicide. We grew up together from the time we were about a year old until we were in college together. So I've got a background in it that comes from a lot of different directions. But really what's most challenging to me is the brain and what it does and how it works. And it is really the last organ in the body that we don't yet fully understand and haven't really fully mapped yet. And yet it is the most powerful organ that we have in the body. And it drives our thoughts and our feelings and our behaviors. So I've been drawn to this field personally and professionally, and through it, just a real deep interest in trying to understand more about how we work and how we live this thing that we call life.
As the Executive Director of the Suicide Awareness Voices of Education, you help develop and write the U.S. recommendations for media reporting on suicide, recommendations for reporting on mass shootings, and blogging on suicide. Will you share a bit about this topic and explain why the language we use surrounding suicide is so important?
Absolutely. The language we use when talking about suicide is really important, all because it affects survivors, those people who have lost someone to suicide, and it affects contagion. Contagion is a real phenomenon. It's a small phenomenon of maybe 1% to 3% or 4%, and it primarily affects young people. But we do know that how people talk about suicide makes a difference in whether or not other people die by suicide. Now, this originally came out of media reports on suicide and the frequency and the dosage rate of media and how they were reporting. We know this extends to everyone and all of us and how we talk about suicide. So many years ago, I led the creation of the U.S. best practices for media reporting on suicide, as you mentioned in some of the other guides that still are in existence. I just revised about a year and a half ago and updated the best practices, and people can find them at reportingonsuicide.org. That's reportingonsuicide.org. And in fact, if you're interested in trying to learn how to talk about this in a safe way, you can scroll to the bottom of that page and you'll see a Verify tool that was developed with Cisco recently and just launched last year. You can just type in some text and it will tell you very quickly whether or not that meets best practices, and it is safe messaging. So really the goal in developing best practices was to help people learn how to communicate about suicide more safely and to reduce the risk of contagion. We're never going to eliminate that completely, but the idea behind these guidelines and how we talk about suicide makes a difference. And just one simple example of that is around the word committed. We often hear people and news reports, but people talking about suicide, they'll say someone committed suicide. That's very painful for a family member or a coworker, a loved one who lost someone to suicide, because we think of committed as being connected to committing a crime or committing a sin. But we don't really want that talked about in terms of committing suicide. We rather would have people say somebody died by suicide or they took their life. So it not only helps frame it for the survivors, but it helps in preventing contagion.
That's a good resource to have accessible to the public, for sure. Thank you for sharing that.
Hey there, listeners. It's your host of the weekly podcast, Redefining Medicine. I have a question for you. How much time do you spend ordering functional lab tests for your patients? Ordering from multiple lab companies for hundreds of patients can quickly turn into hours of admin time. But there's a new way to order lab tests that I'm excited to share with you. Rupa Health is a tool that lets you order 20 plus specialty labs in a single portal. You can order all tests you normally do from companies like Dutch, Vibrant, Genova, and Great Plains, and so many more. Imagine you're ordering a hormone panel for a patient that includes tests from 3 different labs. You have to log into 3 different websites to place separate orders and then come back weeks later to check tracking number and download results. Rupa eliminates all of that by having all ordering, tracking, and results in a single place, and they also handle invoices, tracking shipments, automated follow-ups, personalized instructions for completing tests, and so much more. The best part about Rupa, it's free for all practitioners. Go to rupahealth.com, that's RUPA health.com, to join a live demo or sign up to see how it works. Now let's get back to today's show.
Many are aware that the COVID-19 pandemic has exacerbated our existing mental health concerns, including rates of depression, anxiety, and more. And yet, the mental health and well-being of clinicians themselves oftentimes gets overlooked. What advice or guidance would you provide any clinicians who are having a difficult time in managing their mental health right now?
You're exactly right. The media doesn't talk about the impact of not just the pandemic, but anything happening in our world and our environment on those providers, those healthcare providers. We've seen that during the pandemic a little bit for doctors and nurses and staff that work in hospitals, but not for those mental health clinicians, not for those people out on the streets that are helping people. And yet we know that their worlds have been impacted by the pandemic as well. When people's lives that they're caring for have been impacted by the environment, they bring it into their therapy sessions. They bring it into these counseling conversations. And so we need to make sure that we're taking care of the providers as well as we're taking care of the patients that we're providing care for. I think it's really important for providers to be able to set good boundaries, set some limits for yourself. How many patients can you take? Maybe right now you should limit your practice a little bit, cut back a little bit, because the stress that's being brought on by telehealth and by people needing more services, more people needing services and needing more of it can be exhausting for people. So set some good boundaries and set some limits for yourself on what you can do and what you can't do. Make sure you're taking care of yourself in terms of your physical health. Make sure you're eating right and sleeping right. All the things that we tell patients, we need to remind ourselves for. Oftentimes what I find are that healthcare providers think that we are all superheroes and we don't need the same kind of self-care, but we really do. So making sure we take care of our physical care, get the right amount of sleep, make sure you're eating good foods for yourself. Oftentimes we have providers that when they're under stress, they eat a lot more, or they forget to eat because they're so busy. We need to make sure we take care of our health as well. The other thing that I think is really important for healthcare providers during a time like this is to make sure you're giving back. And it might sound a little ironic that I'm saying do more, but when you're giving back, when you're volunteering, and there's nothing in return for you other than knowing that you've done something good for somebody else. For no pay, for no other reason, just to help out, it actually boosts your self-esteem, boosts your confidence, it boosts your mood. So making sure that we are taking care of our health, making sure we're taking care of the things that we're doing with our clients and setting some good boundaries around that, and making sure that we're giving back actually can really help us get through something like this.
So Dr. Reidenberg, we are really excited to have you join us as a speaker at the upcoming 29th Annual A4M World Congress taking place this December. Could you share a little bit, give us a preview on your topic?
Sure. I'm really excited to be a part of this World Congress and honored to be a part of it with all of these providers that are providing really integrative and unique and comprehensive, thoughtful approaches to our health and our well-being. Mental health today is being challenged in ways that have never been seen before. The volume of it, the celebrities that are coming out talking about it, athletes, politicians talking about it, and talking about suicide losses. And this added to our clients dealing with their distress is a time that we really all need to be paying attention to mental health and suicide prevention even more in the work that we do. So what I hope to cover in a very quick, short 45 minutes is some grounding information about how much this is happening to us, to tell people a little bit about how we understand who's dying by suicide, because oftentimes people think that it is just those people that are struggling with depression, when in fact we actually know research tells us that those that have been treated for depression actually die at lower rates than other diseases, other mental health challenges. So we need some grounding in who this is happening to and how frequently it's happening to. We're going to talk a little bit about how you ask about suicide. It's really important to do some key things when you're asking somebody if they're at risk of suicide, what to listen for and how to pay attention, what you should be watching for in your clients, and how to respond. There are a couple different ways that you can not only ask the question, but also respond that helps both frame things for that person that you were talking to and keeps the conversation going. Talk a little bit about follow-up and how important follow-up is and how to do follow-up in different ways. I'm going to talk about documentation. We all know that it's really important to protect ourselves when working with clients that are not only struggling with mental health challenge, but also that are at risk of suicide. And a suicidal patient really causes a lot of fear and anxiety for many providers. So documentation is one of the ways we can actually look at, if we do it right, can help us in the actual work that we're doing with them. So we're going to cover a lot of ground in a short 45 minutes, but I'm really excited about it. Really hopeful that many people will join us for that conversation coming up here in December at the World Congress.
Thank you so much, Dr. Reidenberg. It was such a pleasure speaking with you today.
Thank you.